decrease and work on the triggers. So we talked about that in regard to diet. What else can we look at and work on? Welcome to my YouTube channel. I'm Dr. A. Today I want to get into the inflammatory component of mast cell disorders or mast cell activation syndrome. In this one, I want to kind of take a little bit of a focused look at three primary areas for mast cell activation. So the first area, basically a foundational area, might change through your treatment. It's a foundational area, and that's diet. One of the things that's not talked about a lot is that a medically supervised fast can reset your immune system and take you from reacting to everything to low reaction so that then you and your healthcare practitioner can deal with the mast cell activation issues. Now, can everybody fast? No. Next thing you want to know about fasting is you're going to get worse in 99% of cases the first 2 days. There's very good research that shows in the beginning of a fast, you're going to dump more histamine and inflammatory mediators. So this is why you may not want to do this right first, the fasting part. You might want to work with your practitioner and get some of the inflammatory mediators handled somehow, and then go into the fasting. And generally what we hear from people is between the first day and a half to the second day, 1.5 to 2 days, which matches the science, histamines go up, you aggravate, you feel kind of worse, you have to stay well hydrated, maybe take extra of the other stuff you take. And then long about day 2 to 3, it starts to get better and better. And by day 5 to 7, you're off and reset. Now, are there ways to do modified fasting and that sort of thing? Yes. Are they as effective as water fasting? They can be, but again, you want to work with a practitioner who understands fasting. But that's one of the biggest tools to reset. It's also one of the hardest to do. Very few people come in and say, I'm just dying to do a fast. I can't wait to do a fast. But if you're really frustrated and nothing else is working, sometimes that's the thing that you require the most, or you require it early on somewhere. Removing triggering foods. Remember that your digestive system has a big immune system. There's a lot of mast cells and other cells that are inflammatory mediator triggers in the digestive tract. The problem is that not everybody has the same foods that bother them. So for some people, it can be, certain proteins. Let's say I've got one patient where they might eat salmon, it's fine, but if they eat beef, they actually trigger mast cell activation. Food is individualized. The first thing with your diet that you want to do is remove things that you don't need in the food. This would be additives, preservatives, colorings, all that stuff. Those are all like throwing gas on the fire of mast cell activation. So you got to clean the junk out of your diet, and you have to have food that's as pure as you can get it. Don't add things. Don't buy food that has a lot of preservatives, additives, colorings, all that stuff, because you just always triggering your system with those things. The next thing would be a low histamine diet, and people often ask, where's the best place to find a low histamine diet? Look online, look for a university-based, either their Department of Nutrition or Physiology, somebody. Why? Well, because low histamine triggering diet also decreases the other triggers that we said. It's not just histamine, it helps kind of all around. And so if you're looking at decreasing triggers in your diet and you don't know where to start, get the junk out, take out preserved foods, colorings, additives, as much pesticide, herbicide as you can, get it out of there. The next thing is antioxidants in your diet. These tend to come from colorful plants. And then supporting removal, elimination. So we need to drink enough water so we're hydrated, but we also need to eat foods that have fiber and prebiotics in them. And it turns out that the foods that have, a lot of good fiber and a lot of good plant polyphenols and antioxidants usually are also good prebiotic foods. So diet's the first chunk. Next chunk is decrease and work on the triggers. So we talked about that in regard to diet. What else can we look at and work on? Mold creates mycotoxins, and mycotoxins are some of the most potent inflammatory triggers that will cause people to have mast cell activation problems. Generally speaking, this is sort of a two-pronged approach. One is looking at your home and or work environment, and there is ways to test those for mycotoxins and mycotoxin production, presence of mold, etc. The other is and you can do testing that sees what mycotoxins are coming out in the urine. Are they perfect tests? No, but at least something to see, is my body burden elevated? So mold and mycotoxins. general allergens and food. Now, we can't avoid all allergens in our world, but certainly if we know we have foods we react to, remove them like we talked about. What about other stuff? A lot of our mast cell patients also are allergic to other things like dust mites and pollens and stuff. And so one of the things that we do with that is we'll have mite covers on their pillows, because then the dust mites can't get in there and you're not breathing it in all night. And certainly if there's other things that you know you're allergic to, avoidance, if you can, is wonderful. Beyond mycotoxins, there's other toxicants like metals and chemicals. This is a big reason why we're so in favor of removing foods that have a lot of pesticides and herbicides, but also colorings and other stuff in it. That's a big way into your body. But also you might need to be tested for the presence or the aggravation of some of these things like metals and chemicals beyond mycotoxins. And then there's what we call comorbid or collateral conditions that make mast cell dysfunction worse. Those include chronic infections you do or don't know you have. A lot of people say, well, I don't feel sick. A lot of chronic infections, you don't feel sick in the traditional way, like you've got the flu. You'll just feel fatigued or you'll be more reactive. Infections that are behind the scenes will aggravate the mast cell family. Remember, it's more than just mast cells. And so the more you can do to diminish those and to help the immune system, the better. The other things to consider would be autoimmunity. And one of the phenomenon that we see in COVID now is people would go into COVID with no autoimmunity, and now they have positive autoimmune markers. So if you have long COVID and it came with mast cell activation, if you haven't had your thyroid autoantibodies and your rheumatic autoantibodies like the ANA and the HLA series, rheumatoid factor, all those things, you haven't had those checked since you had any chronic illness, check them again. We do that with everybody at the baseline because they can come back. And then the other big area is digestive system dysfunction, which you might have to just work on and chip away at chronically. But the digestive system contributes more to mast cell activation symptoms than most other organ systems in your body. And that could be due to improper flora, good versus bad flora in your gut, could be due to some chronic infectious things in there, could be due to many other things. And then the final deep dive in addressing the inflammatory things is supporting the biochemical pathways to get rid of these inflammatory things. So we'll link it above or below, but I've got a little deeper dive into histamine modulation through supporting the three pathways. But you need to remember, even though it's not all about histamine, histamine pulls a lot of the weight, and your body's got three outlets for histamine, and you got to support all three of them, okay? There's the N-acetyltransferase pathway, there's the diamine oxidase or DAO pathway, and then there's the HMNT pathway, which is really long, got lots of steps. They all need support. Here's the problem. All the things above that we said that make your mast cell activation worse, they will slow down these elimination pathways. Really, to do this effectively and all of these things, you want to find a practitioner you can work with who can help you with the different layers. Because here's the other thing, just from managing it from, the healthcare provider point of view. Sometimes need all these things, but your body can't handle it. And so you might say, well, I tried to fast, or I tried to do this and that and the other thing, and I just aggravated. The job of the practitioner is to take that information and say, you need it, but you're not ready for a lot of these things. We may need to start with real baby step things. We might need to do a lot of baseline dietary cleanup, antioxidants. We might need to help you if you can tolerate them with certain supplements. You do want to remember, not all supplements are the same and not all of them are clean. So there's a lot of supplements with excipients and stuff in the supplement that people have sensitivities to. And I've had people where they needed, say, a particular nutrient, but it had, a binder in it that was made out of corn, or it had a binder in it made out of something else they're really allergic to. Well, that's not going to make the mast cell activation any better, right? So working with someone to get the cleanest stuff that you can and helping, okay? So when we're looking at these three areas, whether it's the big picture, deep dive into your diet, or decreasing triggers, which is tons of stuff, and or supporting your biochemical pathways to remove on the micro level, histamine through its three pathways, but all the other inflammatory mediators, and then your detox pathways in bigger picture, you really do need to find and work with a provider that's going to help you there. And together, between you becoming educated, empowered, and working with somebody to kind of give you that macro adjustment and, clinical determination over time of what's probably better and worse for you, you can get to the other side. It's frustrating. It can take a long time, and especially if you've been banging your head against the wall with mast cell disorders for a while, but there is hope and you can crawl out of the hole.